Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Now, my dear fellow students, my colleagues, and those who are appearing in the undergraduate examination or the postgraduate examination, whether it is a membership examination or a fellowship examination. Actually, we are dealing with infection and disease. What you have read before in this section or module is what is called bird's eye view. You don't know nothing about the characteristic feature of the specific bacteria. So we divide the bacteria as a living thing. Most of the earth is equipped with this, all different forms of these bacteria. Infective bacteria are concerning the gram-positive and gram-negative. Now, they may be cocci or bacilli. I have dealt gram-positive cocci and gram-negative bacilli. Very detailed account has been given. If you remember 30% of it, you can achieve very good knowledge. And the gram-positive and gram-negative bacilli. Gram-negative bacilli, no problem. If you ask about the gram-negative bacilli, there are a lot of examples can be given in this context. But the gram-positive bacilli, you have to think before answering this question. A very limited number of the gram-positive bacilli are present. The humans are concerned, Clostridium, and then you can give an example of what is we called as listeria, listeriosis, anthrax, bacillus anthrax, and Clostridium. Now, Clostridium is a genus, I will say. It is not the species, but rather it is a genus because it has got a lot of organisms in this section. And because it is a very long run, as far as Clostridium is concerned, not a easy to go in a brief account. It cannot be given, for example, if you are asked to give a lecture on Clostridium and time allotted to you 15 minutes, 5 minutes, you cannot elaborate it so that people can understand. What is the aim of the tutorial or what is the aim of the lecture is concerned? The only thing is that in the lectures, people come because of two things, mainly. One, to have got a pleasant space to sit it and go to the sleep. The second type of the people who come and attend these lectures, they think that it is better to go inside and make your attendance. They are not following you because the lecturer or the demonstrator or the performer is on the stage and he was only looking on the sides. And he has no time to see the faces of the attendees who are attending these lectures, I mean to say that. So the lecture form of the teaching is now gone. People do come because of the sleep, because of the attendance. Otherwise, they do not want to acquire knowledge. Secondly, the lecturer or the facilitator should know how to facilitate the session. To make this communication useful to the students, you have to have got a practice to do it. And this is the art of teaching. You attract these students. You should attract the students. I am talking about those who are teachers. Attract the student to yourself. Chemotactic phenomena. If you deliver this lecture in another type of a fashion, just do not read on the slide. Just discuss this a matter. And you have to make up some type of clinical scenario on the shadow, you will discuss. That is the best way to teach. And rather to go one line and that's all. And the performer or the lecturer or whatever you said, moderator, instructor, they don't even bother that the student have understood or not. Now thing is this, because the eye contacts and you go to the students, you ask questions, interactive sessions, these are important. The procedure is written in your book. You can read it. You can understand it. For me is concerned as a physician of about 47 years, I have done clinics. The application of this knowledge, the knowledge of the clinical microbiology or the clinical bacteriology is very, very important to me, because I have to see the patient, I have to go for the differential diagnosis and the management studies. So these are the important things. These are basics. They build the pillar for the upcoming knowledge one want to achieve. I am Professor S.A.D. Heather. You know that about me. And I am talking about this genus, that is Clostridium. This is a big chapter. And I am representing actually JSMU as a senior visiting professor of medicine. Now, because of this chapter is a big one, although it is written in your book, that is in the basic books, the PK or the Davidson, hardly 2 to 3 pages are written. But this is a very important type of a problem. There are a lot of scenarios related with this Clostridium. Those who are appearing in the professional examination of the foreign countries or in our countries, CPSP examination or CPSP of the Bangladesh, this is very important to understand. But it is the differential diagnosis of many things. You have to go for the differential diagnosis in every long case. If you are in your long case, if you are discussing the Clostridium, for example, Clostridium valachi, then you have to discuss in detail Clostridium perfringens. Then you know everything about this. In a very near future, we are collecting the foreign examiners to come and join us in the examination of CPS Part 2, so that the standardization of the SPPS should be maintained. One examiner should be from the foreign country, the other examiner should be internal, external and internal. This should be the ideal group in deciding whether the person should be passed in the FCPS examination or not. The foreign examiner is concerned, because he see usually these cases. Clostridium, we do not see, we do not have chance, because we are limited to one ward, the other ward is neglected. We go to the another ward, you miss that ward and forget everything. People are asking me via WhatsApp, this is the case which has been come. It has come in the Peds OPD or in the cardiac OPD or in the urology OPD or pharma OPD. The basics are basics. If you know the basics, you are a powerful person. Please try to understand that this is a long session. So I have divided into 4 parts. The first part is Clostridium, is that a general description is given along with one example. This is part 1, the Clostridium. And these are Clostida in a low microscope. Power microscope, you see these are the gram positive violet color, it's not the grayish violet color. Basically, they are aggregated and some type of Chinese letter formation again. The colonies are there. And the introduction is that the anaerobes, so first of all, they are anaerobes. They do not need oxygen for their growth. Oxygen is the antidote of the of these organisms. Slight oxygen, a very small amount of oxygen, they need some of these species, although, but actually they are anaerobes. I will say strict anaerobes. They grow in the medium where the least zero oxygen is there. For example, in the case of the ischemic necrosis of a part, there is no oxygenation there. The chances of the Clostridium species to go in, to invade it and form the lesion there. This is the concept. The Clostridia are the most widely studied. They are widely studied. This is the only genus Clostridia which are widely studied in comparison with any bacteria. Why? Because they are involved in the variety of the human diseases, the most important of which are gas gangrene. Surgical people, surgical and allied, those who want to become surgeons, please remember the gas gangrene, the dry gangrene, the wet gangrene. The gas gangrene. Gas gangrene is okay, fine, no problem. The part should be amputated. No, this is not the case. The high mortality rate with this condition. This is very problem. Second is tetanus, very common problem. People miss tetanus. They are terrified also. Botulism is not very common disease in your country because you are not using the source of infection like other countries. Another is called the pseudomembranous colitis and food poisoning. Food poisoning can occur by any species of the Clostridium, whether called Clostridium is concerned as the Clostridium perfringens, Clostridium tetanus, Clostridium botulinum, or Clostridium difficile. Whatever the species is there, they will cause the involvement of gastroenteritis or the low stomach and the small intestine and the large intestine. So it is gastroenterocolitis. All can cause. Very least chances with this, highest chances with this, and food poisoning, a specific food poisoning with the Clostridium perfringens and the Clostridium difficile causing the pseudomembranous colitis. The source of infection are human or animal feces. So it is the anus and the mouth. So the poor washing of the hands, auto-infection can occur. Remember, the Clostridia are present in your environment, around your perianal area, around the perigenital area. And this, if it is introduced inside the body to other part where they are not commensals, they become infected, they are invasive, and they cause disease. Surfaces in the room where the least amount of oxygen is there. Unwashed hands, of course, I have already said that. Soil, sludge, mud, water. In water, they definitely, water's upper surface is fine. But what about the second or third or fourth layer in the water tank? They have no oxygen. If some organism died in the water tank, it becomes the source of infection because it is putrefied, And Clostridium will definitely grow as a media, found in the media there. How much of your hospitals with the upper tanks are there and the lower tanks are there? Who is responsible for the washing and examination and cultivation? Nobody. You are just drinking this water, washing your face, etc. in the hospitals. It was a study which was done in the civil hospital Karachi that all of the water tanks, upper water tanks in 1978 to 1985, they are all spoiled. There are a lot of things they have identified from the water tanks. I don't want to discuss. Because you will not take, you will not wash your hands after I will discuss. That's what I don't want to discuss. It's better you wash the hands and go for the antiseptic solution. Put on your hands. It's better. Food, including meat, is a very important source. A very good source of the cultivation of these Clostridia species, botulism, Clostridium botulism, Clostridium difficile colitis, Clostridium tetani will cause tetanus, abortion will cause the Clostridium sordidly, although it is not very common. Gas gangrene, Clostridium perfringens, along with the Clostridium novae, septicum, sodalii, and histolyticum. These are rare species. Clostridium food poisoning with Clostridium perfringens. So these are the species which are involved. Only the four will be discussed here. First of all, we will discuss with tetanus, or we will then discuss afterwards with the botulism, food poisoning, or infection with the Clostridium perfringens, and the last but not the least will be the difficile colitis, antibiotic-associated colitis. The clinical microbiology of the species are the obligate anaerobe, and capable of producing the endospores. You know the endospores, they are forming under the cell wall. They generally stain gram-positive, but as well as bacillus, are often described as gram-variable. Variability means they are the weak gram-positive, for example. The normal reproducing cells of the Clostridium called the vegetative forms. They are rod-shaped, which gives their name spindle shape. Clostridium endospores have distinctive bowling pin or bottle shape, distinguishing them from the other bacterial endospores, which we are usually avoid in shape. Not here, it is club shape, bottle shape. The Scheffer-Fulton stain, this is the specific stain. 0.5% of malachite green water can be used to distinguish between the bacillus and Anthracis and the Clostridium form from the other organism. This is the distinguishing stain. Both are gram-positive, but if you dye with the dye used as a Scheffer-Fulton stain, the Clostridium will be stained with this, but bacillus will not stain. This is a clinical microbiology. Of course, microbiology should know this. The Clostridium can be differentiated also from the endospore forming genus Bacillus, also forming the endospores, by its obligate anaerobic growth, the shape of the endospores, and the lack of the catalase. It is catalase negative. Species of the Moculum from similar endospores can be distinguished by their requirement for sulfur. This organism can cause the abortion. Glycolysis and fermentation of the pyruvic acid by the Clostridia yield the unproductive butyric acid, butanol, acetone, isopropanol, and carbon dioxide. You can demonstrate it. The fermentation. This is a commercially available polymerase chain reaction PCR kit, which is called Bactotype, for the detection of the Clostridium perfringens and the other pathogenic bacteria. So it can be distinguished by PCR. Specific Clostridium perfringens botulism can be detected by PCR. Now this is the bottle shape with high microscope you see. You see the underspores inside, make it like a bottle shape. The end of this bacillus, there is a hole there. Look this in the high microscope, gram positive bacillus. I already said the disease caused by the Clostridium is botulism, botulinum toxin, and the Clostridium perfringens. Food poisoning is important, and the gas gangrene formation or compartment syndrome of fasciitis, they are important with perfringens. Clostridium tetanus causes tetanus. And several pathogens previously described with Clostridia, they are important in the gynecological conditions as septic abortion. We are not discussing this. The Clostridium difficile now plays in the Clostridioides subspecies of this Clostridium. Although it is coming under the heading of the Clostridium, now this is the disease, this is the organism which was previously discussed very little. Although I have written paper on Clostridium difficile for my fellowship examination. And at that time I was considered to be the specialty in this condition. Although at that time, in 1994-95, I have written a dissertation on Clostridium difficile. And I have taken out the buried knowledge which was actually buried inside the grave. And the Americans, they do not like the buried type of the knowledge which is buried, discarded. New things have appeared in 1994-95 for the description and for the detection of the Clostridium difficile in our country. Because of the poverty, because of the cost effectiveness, we cannot do the investigation for confirmation of the Clostridium difficile. That is why I have written that dissertation. I challenge them. And according to the American College of Physicians, they have accepted this paper. It was published in the College of General Physicians, and they comment on it. I answered it, and they are satisfied. They said, yeah, in your country you can diagnose like this, because you have no facilities. How we can diagnose the Clostridium difficile? When people are poor, they are undernourished, how you detect this thing? We will discuss later on. Now, the tetanus is the only thing I want to discuss now because of the time which is going on. The tetanus is also known as lockjaw, very famous in the layman language. It's a bacterial infection caused by the Clostridium tetanus, characterized by the muscle spasm, characteristic muscle spasm in different parts of the body. The most common type of spasm begins in the jaw and then progresses to the rest of the body. So it is centrifugal in distribution, and each spasm usually lasts a few minutes and then relax, and then spasm, then relax, then spasm. Spasm occurs frequently for 3 to 4 weeks. Epidemiology is high. Look, this page, that is a dark red areas. Remember, this is Egypt, and this is the Marrakesh, and down there the Libya, Madagascar, etc., including some part of the Saudi Arabia, not all. And this is your zone, India. And some part of the Malaysia and some part of the Philippines. Highest are there. Light yellow, here coloring showing North America, South America, the Australia and New Zealand. And in grey is there, something part grey is there. means grey means there is white, whitey white, grey means white. No data are available. Highest 1990 to 2004 coming in these areas. They are underdeveloped countries or developing countries. Correct word is developing countries. Because the other nations are helping them to develop, the developing countries. The rate is definitely higher in these areas, including Pakistan. This is Pakistan. This is Iran and Pakistan and Afghanistan. Because of the lack of knowledge. While the source of infection is in soil and saliva, it is present in dust and manure. The bacteria generally enter through a prick in the skin, such as cut or puncture wound caused by the contaminated object. It enters, photo of entry is this. They produce toxins, they interfere with the normal muscle contraction. It's very commonly you see the accidents which are going on the motorcycle, the rickshaw accidents, the cycle accident and so on, road accident that is called. The chances that the break occur in the skin and the bacteria which are commensal on the skin now enter into the other part of the body as infective agent. Incubation period, my God, it may be few days, several months, but it is usually about 10 days to 2 months, 3 months. In general, the further the injury site means away the injury site is from the central nervous system. Further, the longer the incubation period, because CNS, if you want to involve with the CNS, it will take 2 months. The longer the incubation period, the longer is the site which is involved. However, shorter the incubation period will have more symptoms, like from the jaw, dismiss, Clostridium, neonatal tetanus, all muscles of the face, they are jammed. And symptoms usually appear from 4 to 14 days after birth, averaging about 7 days. At one time, the neonatal death is very, very common. Nowadays, it is not very common, although we have achieved a very, very close target because of the awareness programs which are going on, because of the vaccination program which are going on. Etiology of this is that the Clostridium tetanus, it is the facultative, rather strictly anaerobe, I will say. They form endospores, ubiquitous. Endospores are ubiquitous and introduced into the body where there is a trauma, where there are very small amount of oxygen is present. The crushed wound, for example, there is no oxygen there. It will enter and then it will form the culture media as a necrosed muscle or a destroyed muscle. They will flourish on this media and localize there or around the area. Then that's all right, no problem. No, this is not the thing. If you want to demonstrate at this level, you can go for the demonstration under the light microscope or the high power microscope. You can culture also at that part which is affected. Actually, the disease occurs almost exclusively in the people who are inadequately immunized. Actually, the risk factor is the exotoxin which it is releasing, tetanus spasm. The bacteria is still in that area, for example, on the forearm. But if it affects the body nearby and away, remote part, the central nervous system, because exotoxin means exotoxemia. Exotoxemia can act in any part of the body. It needs organic matter, manure. Those people who are gardeners and who are cattlers, shepherds, and those who are looking after the forests management, those who are related with the poultry. Now, in these conditions, there are a lot of debris they are there, and the manure. The manure are the very important source of infection. So this is the horrible organism which is present in the manure, and if a cut is there, they will enter into your body and it will cause this problem. The spores can also be found in the skin surfaces and in contaminated heroin also. Why in heroin? Because the heroin are supplied by the Afghanistan, which is a costly item. The bone meal, in the bone meal, it is diluted. With the bone meal is a source of infection. And that's why the heroin, pure heroin, was not there. It is a costly subject. The people inject that vial which is infected already with this bone meal dilution. Real tetanus can be contracted through the surgical procedures, because the thing is every surgical site or operation theatre, they are not equipped. 100% you cannot say that they are hygienic. I have seen one OT where the people were inside the OT. They were taking the tea, samosas, and they were smoking also. And they are also spitting in the in the bucket. They are eating pans and gutkas. They are laughing with each other, chatting with each other. And I mentioned that to these people that they have, some of them have no gloves. कहेंगे जी हम हमारे पास हैं, रखे हुए हैं, अभी कर लेते हैं. They don't know that the endospores are present around your areas, near the surgical table, near the surgical trolley. They don't know, because you are cutting the wound and you are inviting the endospore to enter in that wound. There are a lot of isolated example I can give. From 1950 to 1985, 3 or 4 times the OPDs were closed. The surgery was not done, or the OT was closed for 2 weeks or 3 weeks, because the person developed tetanus after surgery, post-operative tetanus. And that's why they all are washed afterwards, and contaminated materials, if they found anything, should be out. Another source of infection to me is the cats which are moving around that. Specifically in the gynae wards, a lot of cats, they eat the placenta. Placenta which you have actually should be discarded in a properly. The sister or the nurses, they put into the bucket, and bucket is outside. And the cats are fond of eating these placenta. And they are hovering inside the OT also. मज़ेदार बात देखिएगा. They are a source of infection. There are a lot of diseases associated with the cats. One is they are the carrier or barriers. They may be carriers rather to this infection. And in a very, very sterile sites are the operation theatres. No, I'm sorry to say, they are not the sterile sites, hygienic sites. 100% they are not perfect. So do not go for small hospitals, or don't know how to do it. What are the parameters decided for the surgical sites and surgical teams? They don't know about it. And in this fashion, in the gynecology, which was done by the nurses and the hospitals, they make their own veterinary homes and about 20 to 30% have developed the tetanus there. It was a study that was done previously. Tetanus is often associated with rust, dusty nails. Objects that accumulate the rust are often found outdoors in places, rusty type of any penetrating object, if it cuts you, or even I will say a needle for stitching, if it pricks you, even you can acquire this infection. That is why we will go for the prophylaxis for the tetanus is concerned. An endospore is non-metabolizing survival structure that begins to metabolize and cause the infection once in an adequate environment. Hence, stepping on a nail, rusty or not, result in the tetanus infection as the low oxygen anaerobic environment may exist under the skin. That is why you are providing that culture media there. The puncturing object can deliver endospore to a suitable environment to grow it. It is a common misconception that rust itself is the cause. No. Rust is nothing but the ferric oxide. And that a puncture form or rust-free nail is not a rust. It's trial type of a needle which you use for the stitching purposes, for example. They can be introduce the infection to the under the skin or under the muscle, and it can cause tetanus. And this is the organism. Without a spore, rot-shaped body, the spores are formed, endospores, the bottle shape, there is a core, coat, and cortex. Pathophysiology, that it will inside there is an atmosphere which is going on. It forms the exotoxin. Exotoxin is a very specific toxin releasing of GABA and glycine, blocking its exotoxin, tetraspasmin or tetraglycine. It blocks the release of neurotransmitters GABA and glycine from the inhibitory neurons. And that is why the overactive muscles occur. The muscles are contracted now. Spasms occur. These neurotransmitters keep overactive motor neurons for firing, also play a role in the relaxation after contraction. And there will be a prolonged relaxation afterward, and then again there are relapses, relapsing, remitting, contraction, relaxation, contraction, relaxation. If lactic acid are formed in, remember, if they are overactive muscle, the lactic acid is the end product. So lactic acidosis occurs in these conditions. And lactic acidosis means it is a killing disease on the one hand. And suddenly if it enters into your body and forms the bacteremia as a phase of the infection, then it will be a very deadly infection. So it is indirectly the spastic paralysis because big relaxation and contraction, fatigability, spastic type of paralysis seen in the tetanus infection as the end result. Tetanus spasm, heavy chain and light chain it has, the toxin, exotoxin, 3 domains. The heavy chain has 2 domains, the N-terminal side and the C-terminal side. The light chain domain cleaves the VAMP protein 1 that arises in the inhibitory neuron on the cytosol. So inhibitory neurons, they are blocking it, and which has got very important role, definitely. It is a lower motor neuron or upper motor neuron region. Answer yourself. There are 4 main steps in tetanus mechanism of action. Binding to the neuron, internalization of the toxin, membrane translocation, and cleavage of the target VMP. The vesicle associated membrane protein, which cleaves VAMP. And that is the way how the spasm occurs. Non-neurospecific binding, yes, neuromuscular junction, where the acetylcholine is releasing, it binds to the presynaptic membrane to a motor neuron, the heavy C chain terminal domain binding the correct site to recognizing and binding to the correct protein and glycolipids. This is a mode of action actually. The toxin binds to the site that will be taken to the neuron as an endocytic vesicle that will travel down the axon, past the cell body and down the dendrite to the dendritic terminal at the spine and the nervous system. The anterior horn cells connecting with the inhibiting neurons. That is called interneurons. Interinnervation neurons, they are inhibited. And that is why they are firing and firing and firing. Here it will be released into the synaptic cleft and allowed to bind with the presynaptic membrane and inhibiting neurons in a similar manner seen with that. There are two problems. One at the neuromuscular junction, one at the interinnervation neurons. They are not inhibiting it. On the other hand, the neuromuscular junction, they are excited. So the spasm occurs in a very prolonged period of time and then relaxation occurs afterwards. Because all the material is gone. And then again the cycle repeats itself and the accumulation of lactic acid in the muscles. And result as the spastic type of the paralysis. You cannot, spastic paralysis is the paralysis of the upper motor neuron. So it is the upper motor neuron, the international neurons are involved, not the anterior horn cells. Although the action is on the nerve and the neuromuscular junction, but the end result is the spastic type of the paralysis. Internalization, of course, endocytosis, it will go as a vesicle. Actually, mechanism is not well understood, but the depolarization caused by the firing of the inhibiting neurons causes the toxin to be pulled into the neuron inside the vesicles. There is translocation process going on also. And this toxin forms an ion channel in the membrane with the sodium and potassium channels and calcium and chloride ions. These are channels formation, and in this way, because of disturbances of these cations or anions, and this is the mechanism actually not 100% perfectly understood, but they saw the end result is that the electrochemical gradient will be formed enough, and this will forming the contraction and contraction and contraction and contraction. Cleavage occurs in the enzymatic target cleavage. Tetanus toxin is zinc-dependent protease. Shares a common zinc protease motif. While all zinc was removed from the neuron with the heavy metal chelators, for example, zinc, will go with chelating agent. The toxin was inhibited only to be reactivated when the zinc was added back. So it means zinc is the important part. If chelating agent you are using, it will work definitely. In this fashion, the light chain binds to the vamp and the cleavage between the glycine GLN and the PHE, that is. And without vamp, vesicle holding the neurotransmitter needed for the motor neuron regulation, GABA and glycine cannot be released, causing the above mentioned regulation of the motor neurons. So theoretically, if you will block the zinc by chelation, the contraction which is going on will be gone. This is what the conception, although it is not clinically beneficial, but theoretical side, yes, it is. The clinical feature, it will cause the lockjaw, dismiss, contraction of the muscles will cause rises. In the case of the patient is, we see that it seems to be smiling, and the smile is a deadly smile, I will say. The chest, neck, and back and abdominal muscles may be affected. Back muscle spasms can cause arching of the Tetanus, and muscle utilizing during inhalation and exhalation. This is an important point, which can cause the respiratory failure, type 2 respiratory failure. The prolonged muscle action, sudden powerful and painful contraction of muscle groups called tetani, because they are repeating. That is called the tetany. It is not convulsion. It is tetany. These episodes can cause fractures and muscle tears. The muscles, if the bones are weak and there is powerful contraction around it, the muscle can be, pathological fracture occurs there. The other symptoms include the fever and headache and restlessness, irritability, feeding difficulty in a child, breathing problem, burning sensation during urination, urinary retention, and a loss of the stool control. These are the clinical features. Even with treatment, about 10% of people who contract tetanus die. The mortality rate is higher in the unvaccinated individuals and in people over 60. There are two important, aspects of life. Whether it is neonatal tetanus, the mortality rate is high. And the people over 60 years of age, if they have developed tetanus after injury, high. Unvaccinated individuals. Now, because of the vaccination program, their mortality rate is much, much decreased. This is an important subject to be discussed because the people are doing house jobs in the medicine, medicine allied and surgical allied. They should know about this. I stop here because I have already taken 45 minutes or more than this. I will continue as this tetanus as a part 2 of the of my tutorial, inshallah, tomorrow. وما علينا إلا البلاغ رب زدني علما. السلام عليكم ورحمة الله وبركاته.